Good morning students. Today it is a very brief topic about fever associated with rash, because in two videos previous ones what we have been discussing about definition of fever and fever of unknown origin. So while evaluating fever, many times we have discussed history and physical examination are quite important. So either during history or examination you might have found some skin lesions, especially in association with fever. So there are various descriptive terms for rashes, but it is not going to be exhaustive list. I try to simplify because the majority of them with the proper terms we can diagnose and communicate with our colleagues or our assistant professors, especially the dermatology department. They will be more than happy if you correctly label these skin findings. Specifically, there are not many skin findings associated with fever. Most commonly what we see are macules. Macules are nothing but flat areas that I am going to show in this diagram. So, flat areas and discoloration. That means if you are palpating skin like this, they shouldn't be palpable. That is the first point. Second thing is that if you are applying light pressure, their color should change. Either it may become normal. So, this is known as blanchable one. So, blanchable flat lesions are called macules of any size. So, macule is blanchable erythema, that in this diagram you can see. So, blanchable erythema is the description of macule. It should be flat, it can be of any size. Okay. Second one is papule. Papule is nothing but a macule which can be palpated, especially if it is more than half centimeter in size. Papule can be skin colored or erythematous, means reddish in color. So, these are the descriptive terms for these skin lesions. Depending upon the fever, I am not going to give exhaustive list of all these causative or etiopathogenesis of fever. Either can be centrally distributed or peripherally distributed. So, we have to give morphology. Morpho means description and distribution. And their time over a period of days or weeks when the patient is having fever, how they are progressing. So, these three are quite important: morphology, distribution and time course. For example, if a patient develops fever, you have to describe these are maculopapular lesions, centrally distributed, and over a period of 3 days if you are serial observing, they are progressing either from periphery to center, or more often from trunk towards limbs. So, the progress one has to describe. So, this completes the description of our skin lesions. Second variety are Vesiculobullous lesions. What are vesicles and bullae? Both are nothing but same, that you can see in this diagram. If it is less than half centimeters, means less than 5 mm, it is described as vesicle, small ones. On the other hand, these vesicles are becoming larger and larger, but remember, they should have clear fluid, means they should be either completely transparent or semi-transparent, but not opaque. So, if it is opaque, and especially in the presence of fever, we have to label it as pustule. Pus means pus accumulation, purulent discharge. So, less than half centimeters vesicle, more than half centimeter, therefore more than 5 mm, it is bullae. In many of these settings, these two are associated in a single person because they are evolving. It is known as Vesiculobullous lesion. On the other hand, if you see anything blister kind of, blister is a general term. Instead of having clear fluid, means almost transparent fluid, if it is opaque, then you have to suspect it might be purulent, means pus. So, that is why it is labeled as pus. So, papules, vesicles, bullae, whatever we call, they should be palpable but differing in their dimensions. Got the point? Last but not least, one of the common things what we see are known as purpura. Purpura, the name itself tells, purple. Why it is labeled as purple? Any bleed under skin, it is not bright red. It will be almost purple in color. So, if you see a patient with purpura, that means underlying pathology is bleeding, can be of any etiology. But remember, there are two important types which you can diagnose by seeing the patient or by touching the patient. And if you can differentiate these things, your assistant professor will be more than happy. They are divided into two types. Non-palpable purpura means just like macules. I have told earlier, macules are not palpable because they are flat, just a discoloration, that's it. Again, our professors have divided these things to create headache for us and to prepare us for this NEET PG entrance. It's okay. In some settings, we can see only Petechiae, like early dengue fever, that is known as a tourniquet test that we are going to discuss in next video. Less than 3 mm, it is known as Petechiae, but pathophysiology would remain same, that is bleeding within the skin. If on other hand it is extensive, means in thrombocytopenia, hemorrhagic fevers, if it is extending more than 3 mm, it is known as ecchymosis. So, basic pathophysiology is same. You can remember like this, remaining all are half centimeter, 5 mm, 5 mm, 5 mm. Only for purpura it is 3 mm. Why they are given like this? Only God knows. It all depends upon the whims and fancies of those who have first described all these things. So, Petechiae, ecchymosis are nothing but subcutaneous bleeds. Most often these are because of low platelet count that often happens in our common dengue fever and also in autoimmune diseases like autoimmune thrombocytopenia. Other thrombocytopenia you can encounter because of myelodysplastic syndromes, MDS. If you remember this word more than sufficient, MDS is nothing but myeloid, bone marrow, dysplastic means abnormal, syndrome means abnormal bone marrow that is failing. So, abnormal bone marrow can lead to suppression of all cell counts, especially in the form of thrombocytopenia. Other things are secondary cause of thrombocytopenia like our cirrhosis, kind of those things. Okay. On other hand, if you see this palpable purpura, means you are able to palpate. If they are really painful like this, tender, then you have to suspect what is that. Here the problem is not in the cells, because they are palpable, the problem is elsewhere. Where that might be? Please guess. I will tell, it is in the vessel wall itself. So, what are those diseases that affect vessel walls that you know? Many diseases, but I will tell. Common umbrella term for such things is known as vasculitis. Vasculitis means blood vessel inflammation. Inflammation can be because of infections or because of autoimmunity per se. So, like Heinloch Schönlein purpura, HSP, kind of those things that you can see in this image. Okay. Shall we go to next point? Urticaria. To make our life miserable, actually this science has come from Greek and Latin. This is a Latin word. Urtic means that plant, thistle plant, which used to cause sensitization, means pricking sensation, urticaria, pricking sensation due to a plant. That's why it is labeled as urticaria. So, it is most of the times itchy and erythematous. and they flare up like this also, that you can see in this image. Other term that we use for this condition is hives. Hives means crops of swelling of skin, especially erythematous zones, that you can see this diagram. So, if you say this word either hives or wheals or urticaria, it is same thing. But as far as fever is concerned, you have to label it as urticaria-like, not urticaria. Urticaria is completely different condition. So, when a patient is having such hives, you have to write this word urticaria-like lesions, not urticaria fever with urticaria. Urticaria-like lesions with fever. Then you will probably be more than happy. Okay. Earlier also I have told at the beginning of chapter, I am not going to give exhaustive list of all these skin lesions. But these are important as far as your knowledge is concerned, though you may not see. Actually, I have not seen many of these things during my entire MBBS. But to create anxiety among those who are appearing for NEET PG, all these things, such points have been highlighted, and these have been eponymous words like Forschheimer spots. These are nothing but Petechiae. So, Petechiae earlier we have seen. Petechiae means erythematous lesions, but here on palate. Palate is there you can see these Forschheimer spots. These are seen in various types of viral infections. Classically, it has been described with rubella. Other for rubella is German measles. But nowadays, these have been found. That's why they become non-specific for both infectious mononucleosis because of Epstein-Barr virus and a Zika virus also. Why we have to remember? Because this is more often asked. In measles, especially when there is gradual onset of fever, when you examine the patient in detail on buccal mucosa, especially on lateral side, you can see whitish spots like this with the center clear. That will be shown in images, small lesions, 1 mm, 2 mm. In those days, doctors will be meticulous to observe the patient, but nowadays we are more meticulous in watching Instagrams and reels. But with same care, if we observe these things in measles, we can observe these Koplik spots. Why I am stressing upon? Because these are pathognomic, means if they are present, you are dead sure that this patient with fever and rash is having measles, unless proved otherwise. So, remember these Koplik spots, then only you can remember Forschheimer spots, because they are not specific. Coming to another one, where fever with rash is labeled as slapped cheek appearance, that will be shown in this diagram. Slapped reddish erythematous macules. It is known as Erythema infectiosum, also known as fifth disease. Anyone of you know why it is called fifth disease? Why not first disease, second, third and fourth? Any guess? When we understand medical history, the first disease that has been described in detail, which is associated with rash, is measles. That here, this measles is known as first disease. First disease. Then there should be second disease. What is that one? Any guess? Have you heard of this term scarlet fever, which we often won't see here? Scarlet fever. Okay. Third one is this one, our beautiful rubella, German measles. So, this is measles, this is German measles, scarlet fever, in between you can remember. You may ask, what is the fourth disease? Some people have misdiagnosed it. Actually, it was a measles, and because of atypical picture, they labeled it as another term, fourth disease, but later it is proven that there is no such fourth disease. So, that has been omitted. That happened later, but unfortunately, in meantime, this has come. Our parvovirus B19, fifth disease. That's why it is known as fifth disease. There is also one more thing known as sixth disease. This is an homework for you. I will give you a clue for that thing. It will start with first alphabet E and X. So, you can fill up this blank. So, these are all for impressing your friends during clinical rounds, or few are useful for your NEET PG. We will go to next slide. There are few catchy terms that have been described in our textbooks. If you read Algappan or Harrison or Davidson or some other book, these are common terms that you encounter. What is this? Lyme disease. Fortunately, it is not there in our country, but it is very common elsewhere in Western world because of a bacteria. What it might be? Borrelia burgdorferi. This you can see this image. Erythema. Again it is a macule. Migrans means migrating. Here, once this bacteria enters the skin, over a period of 2 to 3 days, assume this is a skin, it gradually migrates. So, whenever it is migrating, it is eliciting host tissue response. So, erythema will be there, and as it migrates, the previous areas where it has been there, now they become normal, means blanched, coming back to usual original color. So, this margin will be progressing like this depending upon the migration of this bacteria under the skin. Erythema migrans, it is migrating, erythema migrans. In annular form, it is going because there are many spirochetes progressing like this. You can see annular forms. This we have got in India. I don't know present status, but in our MBBS days it was very common. Children used to come with a dancing like this, Sydenham's chorea. Last time we had discussed chorea. Chorea means dance-like movement. Any child coming with rash and dance like these movements, they will go like this, choreoathetosis it is called. The first diagnosis was rheumatic fever. Then you used to swab the throat, send for culture and start on penicillin. After that, long-term intramuscular benzathine penicillin we used to give. But here, one of the findings which might be helpful are erythema marginatum. The difference between migrans and marginatum is different. Actually, this erythema marginatum is the one of the criteria for Jones major criteria. So, if the patient has got this erythematous lesion, one of the major criteria is satisfied. That is shown in this diagram. Marginatum, this preformed toxin is happening. Wherever toxin is forming, it is becoming reddish, erythematous. Whereas in previous affected area, it is getting cleared. And there are so many lesions like this. So, clearance, here they are not migrating, they are happening and disappearing. So, they may become confluent. So, wherever toxin is there affecting the skin, that margin will become reddish, remaining area will be either blanched or normal color as shown in this diagram. Next one is, as far as fever and rash is concerned, Nicol's skin means sliding skin, You can encounter classically in non-infectious etiologies like pemphigus, that is different, pemphigus. But it is not 100% specific because this entity, 4S, what is this? Induced by Staphylococcus. Detachment of skin. If it is severe, it is called 10. Toxic epidermis necrosis also. There are many etiologies for this thing, but we limit our topic to this discussion only of SSS. Staphylococcal scalded skin syndrome. It is one of the very dangerous conditions where preformed toxins of Staphylococcus will make this detachment of epidermis from the dermis. So, skin, if you press it, it slides forwards as shown in this figure. One of the dreaded bacteria as far as microbiology is concerned is Pseudomonas. It can grow anywhere. On the surface it can be there, in water it can be there, in our usual antiseptics it will be there, it will be just lying there, it is a contaminant. But in some individuals, it will cause dreaded infections, especially those who are having neutropenia. Like earlier we have discussed, what is the definition of neutropenia? And in some immunocompetent individuals, because it can survive even heat, because it is heat resistant, those who are having hot showers with the tight underwears or bikinis or in hot tubs, after a gap of 2 to 3 days, they develop extensive lesions, macules, papules, kind of those things, especially in these swimming zones areas like groins, axillae, kind of those things. But fortunately, because they are immunocompetent, most of times it will resolve over a period of 1 to 2 weeks. No antibiotics are required except meticulous personal hygiene. It is due to Pseudomonas aeruginosa. On other hand, in immunocompromised, who are they? Organ transplant, diabetics, HIV, renal failure, cirrhosis, Ecchyma, gangrenosum. So again, skin blistering, ulcer formation, gangrenous type. It is not gangrenic, gangrenous type, ulcer formation. That means extensive involvement, Ecchyma, gangrenosum. You should be treated with anti-pseudomonals. In previous days, we used to give 2 antibiotics for Pseudomonas, but nowadays it is not necessary. Single antibiotic is sufficient. Coming to penultimate part, this triad you may encounter again in immunocompromised individuals who are having fever with rash, fever, myalgia. Myalgia means in first video we have discussed, that is muscle aches because of release of cytokines, along with nodules. Nodules are, what is the definition of nodule? Palpable skin type lesion nodules. If they are erupting, coming in crops within 2 or 3 days, fever, myalgia, crops, especially in HIV patients, we have to suspect not albicans, Candida tropicalis. Fine. So these are the few of the skin lesions which I have described, which will be useful for second year MBBS graduates or even those final year MBBS who are attending postings. I hope you examine patients thoroughly, take the history and the physical examination. So without physical examination, we will never be complete doctors. Okay. Just now I rounded off the final one, eschar. When we were medical students, there was sudden manifestation of previously that disease we didn't know, though it was mentioned in microbial textbooks. I am forgetting author's name. That is known as anthrax. So in Chittoor district, there was sudden surge of anthrax cases, black necrosed skin tissue. So in those days we used to think that eschar is the pathognomic of anthrax, that as shown in this diagram, but it is not so. We can see eschar or ulcers, lesions in other diseases like our Rickettsia, especially Scrub Typhus. This Scrub Typhus often we encounter in or around Hyderabad. So any patient having fever with rash, with eschar, especially in this area in or around Hyderabad, which has got a shrub vegetation, suspect Scrub Typhus. Any doubts if you have got, you can ask me or post a comment so that we can discuss. Thank you.